Yeah, the speaker's silhouetted pretty well. But...
Yeah, I know. Well,
I think that was better. Yeah, I think so.
cool.
Would you start the live stream and then?
I already did.
All right. Want to thank you all for being here. Appreciate y'all taking time out of your afternoons to come and listen to some science. Scholars have been hard at work all trimester on their projects. I'm really excited to hear about these four. And I know that the four people presenting today are both nervous and excited. So hopefully we'll give them their full attention, give them our full attention. We'll have time for questions and answers at the end of all four presentations. So without further ado, we'll have Jackson up first.
Where's the,
With a little bit of further ado, we'll have Jackson up first. Yeah, get you all minutes. Slideshow.
Hello everyone, I'm Jackson, and today I'm going to be sharing with you my project about the mechanisms of beta receptors and understanding their ligands. So last year, my brother began taking Nadolol for a heart condition called ventricular tachycardia, and doctors prescribed him with a beta blocker to reduce his arrhythmic episodes. When playing soccer, he explained he had symptoms of feeling like he was playing with bricks on his feet, and he had blurred up glasses. And how and why, I wondered. On the surface, it was easy for the doctor to explain to him that the medication causes his heart and lungs to be a lot harder to use, and this lowered the oxygenated blood that circulated throughout the body. But how did this happen? My overall question examines the effects that a molecule has on the human body and how minimal changes can cause such opposite effects. So for some background here, the beta receptors are receptors that are present on the cell surface of vital organs and tissues, and they're included in the sympathetic nervous system. When they're activated, it causes physiological responses when bound to by specific molecules. There are many different responses throughout the body that can happen, but it's mostly due to the fact that they're on different parts of the body. The two type of receptors I'll be looking at are beta-1 receptors, which are focused on the heart, and when they're activated, it increases the pumping force and increases heart rate. And the other receptor are beta-2 receptors, which affects the respiratory system, and then when they're activated, it relaxes the lungs. So when you block these receptors from different ligands that bind there, it causes the opposite reaction and decreases the heart rate and constricts the smooth muscles. So there are three ligands that I will be focused around, and so on the left there are natural ligands and agonists are very similar in that when they bind to a receptor, they cause an activation. And there's a molecule there, and that's adrenaline, and it's a pretty unique molecule because, as you know, it's naturally in the body, but it can also be used as a medication. And one medication is an EpiPen. So when you go into anaphylactic shock, you want to make sure you keep the heart rate going and make it allow easier breathing. The other two are antagonist and inverse agonist. And when you bind an agonist to a receptor, it blocks other agonists from binding, but keeps the baseline activity. And when an agonist binds to one of these receptors in your body, you would only notice a pretty big difference when you're doing, when you're like active or you're in that fight or flight response. And an inverse agonist not only blocks the agonist, but it also affects the baseline activity. And when when you stop the baseline activity, you can really see a difference when you're not even in that fight or flight mode, or you're not active. And this molecule right here is propranolol, and this molecule is a non-selective agonist for beta receptors, and it was actually the first beta blocker to be created in the 1960s. And I put these two up here to show how similar these molecules are, yet they make such a large difference in the human body. So here's what one of these receptors would look like on the membrane, and it's called, and all of these receptors are called 7-transmembrane G protein coupled receptors. And that's because the protein goes across the membrane 7 times, and it also has a group of proteins inside the cell. And here is what that receptor looks like, kind of like a little bit more detail. You can see how many times it could go across the membrane. There was a membrane in the middle. And just the last bit of background here is that I wanted to give an explanation for the mechanism when a receptor is active. So when the receptor is activated, those G proteins inside the cell move off to this enzyme, which turns ATP to CAMP. And that when the CAMP levels raise, the protein kinase A is activated, which opens up the calcium channels, which causes a cellular response. So that means the more activation of the receptor leads to more cellular response, which is either the increased heart rate or opens up the lungs. So, my essential question and topic I focused on were how do small changes in the molecular structure influence specific medication a physician chooses when prescribing beta blockers. And I wanted to know how each, the agonist, antagonist, and inverse agonist, causes these reactions: fast heartbeat, slow heartbeat, or opens the lungs when reacting with the receptor protein. There was a couple ways I could find my answer. I thought maybe I could create animations or build a model, and although this would be a great idea to show how these reactions occur, I've never taken any coding classes or talked to Liam for any advice. The first two options would be awesome, but learning how to do art would be a project on its own. My other option was to create my own experiment, and this was quickly shut down because we didn't want to mess with anyone's heart rate or respiratory system in high school. So the best option was for me to read up on experiments that have already been done, and this took a lot more time than I thought, mostly because each experiment that I was reading was either too shallow or too old. They were too simple and short. They weren't also specific to what I was trying to research. And one of the most frustrating was that there were several studies that had such specific language that I wasn't able to understand in only a trimester course. And without taking a biochemistry level course from Dr. Pichet, I would have no idea what any of it meant. But thankfully I found the experiment, and it was done by the Interdisciplinary Center for Mathematical and Computational Modeling. And this study was specific to what I was trying to research, and it was perfect to finding my answer. Although at first none of the language in the write-up made any sense, I eventually learned the vocab pretty quickly. And by far the coolest thing about this experiment was how it was done. And they used something called molecular dynamics. And this was a computer simulation where they analyzed the physical movements of molecules and atoms. So here are all the molecules that they used in this experiment, and they had 4 agonists, 4 antagonists, and 4 inverse agonists. And those 3 molecules were used in a specific part of the experiment where they looked directly at the binding 2 pocket, the beta 2 binding pocket. So here's the binding pocket of the beta 2 receptor. And they simulated each, the agonist, antagonist, and inverse agonist in this pocket, and then measured the bonds that were created. So for the agonist, they formed mostly hydrogen bonds with points in the TM5 region. And this disrupts the interactions in the helices in the extracellular region that leaded to receptor's flexibility. And the TM5 and TM6 regions form nonpolar interactions inside a cell, which move apart from the TM7 region, which cause an expansion inside the cell. This expansion allowed water to come in and then lead to that activation state. And this active signaling of the agonist would be used in medicine to treat conditions like asthma. And you would take it through the lungs because if you took a pill, it would also affect and come in contact with the beta-1 receptors. And you wouldn't want to do that if you didn't need to raise the heart rate at all. So for the antagonist, which was the beta blocker, it forms mostly nonpolar interactions with the residues in both the TM5 and TM6 region, which caused the receptor to stabilize on the outside of the cell, but it did not affect baseline activity. And someone would need this reduced activity if they didn't want molecules like adrenaline binding to that receptor, but they wanted to keep the baseline activity. And a physician would prescribe this type of medicine if they did not want to affect baseline activity, but when someone is active or in that fight or flight mode, they don't want the heart rate to go too high. And lastly, for the inverse agonist, the molecule mainly forms with nonpolar interactions with the residues in TM6, which is in the top right. And this reduced flexibility and slightly closed the receptor inside the cell. Not only does this block the agonist like adrenaline, but it also reduces the baseline activity. And for a patient to need this reduced baseline activity, they would need to have an extremely rare and high case when relating to these organs. So let's say someone had like a very high blood pressure, they would want to take this to lower their blood pressure. So now zooming back out, this is the full receptor, and they measured the area on each helice of the protein, and for each the agonist and its agonist and inverse agonist. And I wanted to show this because on the last slide it was kind of confusing because some of the molecules looked, even like in the inverse agonist, looked like they had more interactions with the binding pocket, but when you zoom back out, you can really see how the agonist has a higher volume, higher area for the whole receptor, especially on those TM6 and TM7 regions, which does stabilize the receptor. So why is this important? For those managing heart conditions, knowledge about how medications work can empower them to make informed decisions with their healthcare provider. For instance, someone with ventricular tachycardia might better understand why a selective beta blocker for beta-1 is chosen over a non-selective beta blocker. It targets the heart specifically, reducing the side effects like shortness of breath that might affect their daily life. And in the future, using these ligand receptor dynamics to design drugs that precisely regulate activation levels improves treatments for arrhythmias and other cardiac issues. And an example that of a treatment that it can develop is they still have not created a beta-2 specific blocker, and this would help out asthma patients a lot. And that's it. Thank you. Any questions?
I'm sure somebody has a question for Jackson.
Here's my source.
So I was thinking about the inverse agonist
Yeah.
that you were describing there. And I don't understand what you're talking about, but so the receptor, is it sort of active then? Do you know what I'm saying?
Sometimes just like those proteins right here, they would go off anyway with just at a baseline activity at a constant rate.
Because of the receptor, right?
But just even without being binded to,
Yeah.
they would have a constant rate of going off and reacting with that enzyme anyway. But it's very slow, but it's still there. And the inverse agonist reduces that and closes the receptor compared to the agonist or
And it's the water that's actually activated?
When the water goes in, it sends it off.
Okay, I have a second unrelated question. So, how did you go about reading articles that you didn't fully understand and then to come up with this kind of understanding?
Yeah, so when I started looking at a bunch of these experiments, I saw a bunch of words that kept coming up, and then I would just even go to YouTube or search the definitions, and then I would just start learning the terms that are used in the experiment. And then once I got a grasp of like what I wanted to learn, like for this experiment, I would just keep looking up terms as they came up. Like, for example, this measurement of area is called an angstrom, I think I'm pronouncing that correctly, and that kept coming up when measuring area for molecules. And so I just kind of learned it based off of that.
Thanks, Jack.
Thank you.
Hello everybody, I'm Will, and today I want to talk about small smiles experience big fears, and basically understanding dental anxiety. The why to my project is, as a kid, I never looked forward to the day to going to the dentist. Like the thoughts and the looks of the dentist scared me. I mean, I was scared of the sharp, scary looking tools that they use, and sometimes when they poke me or hurt. I mean, now, as I got older, I'm not as scared anymore, but I think it would be really helpful to inform everybody about dental anxiety, which is why I chose this topic. So, what is dental anxiety? Dental anxiety is fear experienced commonly by people of all ages relating to dental visits or dental procedures. Dental fear affects about 50% of the population and 22% in youth or adolescents. This can lead to many to avoid the adequate treatment they need. Affected children can experience racing heartbeat, sweating, signs of panic, and even cases of fainting. These are obviously not healthy for an oral health of an individual, as avoiding going to the dentist for something like an annual checkup can lead up to dental diseases to form and these diseases to worsen. This is not only cause for patients. This can not only cause a problem for patients, but can also be a problem for the dentists themselves. Dental phobic patients can obstruct the dentist's job during the procedure they're performing and block the dentist from doing their jobs, like performing a regular checkup on a patient's health or just cleaning their teeth. And even in some cases, this can also be dangerous, as dental tools can be sharp and the patient's distracting the doctors can lead to an accidental move that might cause a serious injury. So my essential question is, what percentage of Williston students experience dental fear during their childhoods? And today I'll basically uncover the causes of dental fear or dental anxiety, its impact on not just the patients, but also the doctors, and ways to prevent this. My process, first I researched the cause of dental fear and basically what it is. I read different research papers with different information ranging from the cause of dental fear, and the prevalence in children, and different ways to prevent dental fear. Then I began to think about ways to connect to a healthcare professional so I can ask about real life examples and learn more about their experience. I asked around the class, and this was when I was introduced to Jackson's grandfather, who worked in the dental industry. Dr. Mark Goldstein runs a dental practice called Special Smiles, and it specifically works with dental patients with special needs. I basically had a 30-minute call session with him and asked him several questions about his experience caring for patients, specifically special need patients, and how they behave in dental offices. Well, I know that special need patients are not the same as children, but they also experience dental fear. I learned from Dr. Goldstein that special need patients are really hard to work with and can experience high levels of dental fear. And he gave me insight in how to reduce dental fear for these patients, like altering the surroundings, like the picture you can see up there, where they basically changed the layout of the office themselves and added like greens on the wall and different designs on the wall to make it not look like a scary place. But overall, Dr. Goldstein has provided me with helpful insights about his experience as a dentist and dental fear itself. Next, I want to talk about what I did next was then I thought about ways to like sample the Williston community, and this is when I came across a previous study, which is on the left up there, and this was basically like a previous study done of dental fear or dental anxiety by Dr. Connect of the American Dental Association, and he basically compiled a survey which asked and is really useful to measure dental fear of patients. I decided a survey is the most ideal way to do this. So I incorporated some elements of his survey into my own, and I made my own survey. So I basically made a survey compiled of 15 different questions with responses scaled 1 to 5, which is shown up there on the right, to ask students what level of fear they experience as a child in the dentist. I then sent out this survey to Williston students and received like 40 plus responses. Here are my results. I made different graphs of, I basically gathered all the data and divided what skill level there are, and I made percentages of it. So through the survey, I've compiled in-depth data from the Williston community, and I put them in graphs. The first graph labeled fear likeliness related to dental exists, which is up there. This graph, these questions are questions 1 to 5 in my survey, and these questions are measured in likeliness, and I included questions like experiencing dental fear as a child, missing dental appointments because of fear, questions relating to emotions, like feeling nauseous or heart beating faster, and I have determined that basically a rating of 4 or 5 for these 5 questions are the signs of dental fear. And I basically find that the findings show that 10.7% of all responses had a rating of 5, 8.3% of all responses had a rating of 4 for these 5 questions, which totals out to 19% of fear likeliness within the Williston community as a child. The second graph, which is down here, I basically presented 2 images, and I asked students what they felt as they saw these images, and these are questions 6 to 7 in my survey. I determined that a response of 3, 4, or 5 are signs of dental fear, and through the graph, it shows that 11% of students had a rating of 5, which is also measured as most fear in my survey. 2.4% had a rating of 4, which showed high fear, and 17% had a rating of 3, which showed moderate fear. This all adds up to about 30.4% of Williston students, which showed dental anxiety to these images. The third graph, which are questions 8 to 9, basically fear level measured before procedure, which is up here. And these are questions 8 to 9 in my survey. And I have determined that rating of 3, 4, or 5 are signs of dental anxiety. The graph shows that 10% of students had a rating of 5, which is once again most fear. 3.7% of students had a rating of 4, which showed high fear, and 10% of students had a rating of 3. This totals out to around 23.7% of students experiencing fear before dental procedures. The final graph, which is down here, is measured about fear level during the procedure. So I asked like different questions, what they felt about dental procedure, about like what the doctors do to you during a dental procedure. And these are questions 10 or 15 in my survey. And I've determined that a fear rating of 3, 4, a rating of 3, 4, or 5 are signs of dental anxiety. The graph shows 11% of students had a rating of 5, which is them experiencing the most fear during the procedure. 10% of students had a rating of 4, which is them experiencing high fear, and 19% of students had a rating of 3, which is moderate fear. This adds up to a total of 40% of students experiencing dental fear during procedures in their childhood. Now to like summarize my findings and present some treatments is through the 4 graphs, I basically added up all 4 of the percentages and divided by 4 to find the mean percent of students that experience dental fear during their childhood. And I found that 28.3% of Williston students experience fear or dental anxiety during their childhood, whether it's like before a procedure or a visit or during the procedure itself. My data correlates pretty well with research done by the Dental Association, as professionals found that around 22% of child experience dental fear. This shows that dental fear in the Williston community is actually pretty prevalent, and through the graphs it also shows that the most common cause of dental fear from students in the community is during the procedures, and which is most likely caused because of by the sharp objects used by dentists, or the fear and unknown, fear of pain or unknown to a child. And I just want to say some about like the several ways to prevent dental fear with children. But I think the most important one is basically communication with dentists. Like a child or the parent can let a dentist know before the treatment that they experience fear themselves. And basically create like a signal with the doctors, with the dentist, to symbolize stop. So whenever a child feels uncomfortable, they can like signal the dentist.
I have 2 questions. So the first one is, you said that you averaged all of the graphs and divided by 4, but I'm wondering, one of them was just images, right? It was just reaction to images.
Yeah.
So why did you take that to be necessarily like indicative of childhood fear of the dentist? Why is that necessarily correlated with like to these images of reaction?
So I basically like presented images of like different procedures that a dentist do, and like asked the respondents like what level of fear they felt. So it kind of like still shows like still like it's pretty similar to the other questions that I asked, which is all like the level of fear they feel, or like the likeliness of fear that they have.
But I'm just wondering, because we're talking about, so what's the difference between, like, where's the line between childhood and now? Because you kind of talked about the results for children, and you're comparing your results to data about children. So I'm wondering, is it fair, I mean, maybe this is what you're saying, is that this reaction to images shows that they had fear as a child. Is that kind of what you're saying?
Yeah. Like I stated in like the beginning of the survey where this whole survey is like talking about your experience in your childhood. So like I'm not asking what they I'm not really asking like the emotion that they feel right now, but like I want them to look like in a perspective where like when they were a child.
I was wondering how you chose like which ratings to count as having dental fear. You said like for some of them it's 3, 4, and 5. So it's 4 or 5.
So like my first graph, I measured like the likeliness, and the rating of 5 and 4 is most likely and pretty likely, but the rating of 3 for my first graph was like neither likely nor unlikely. So like I determined that a rating of 5 and 4 is like the signs of fear. But for my other 3 graphs, I use like fear levels. So like 5 is most fear, 4 is high fear, and 3 is moderate fear. So I also incorporated 3 into it because of basically what the question is asking, so like the wording of it.
Do you know what picture like generated the most fear? Or like what like things?
Yeah, it's the sharp tools that the dentists use. Yeah.
Did you
Last
take,
question, then we gotta go.
go ahead. Did you take into consideration the demographic background of the child? I'm just curious. Right?
I didn't factor in any other factors because I thought like childhood dental experiences was like pretty common within like the Williston community. So maybe that's something like I can look forward into next. Like are there any factors that affect this kind of experience in their childhoods?
Try like that.
Hello everyone, my name is Will, and have you ever had trouble staying focused? The music may be the piece that's missing. The question that I conducted my research on was what music is the best for studying? As someone who has always been easily distracted, I found myself having a very difficult time staying on task and completing assignments. Music was a tool to help me stay focused and minimize distractions while completing assignments. One of the things that I've always been interested in is what genre of music is best for studying and allows for the most amount of productivity. Through my months of research and conducting experiments, this is the question that I sought to find an answer for. 2.5 months later, I can confidently say I have found the genre of music that is the best for studying. To figure out what genre of music was the best for studying, it is important to learn from what others have found out about music and the effects on the brain. Scientists have used functional magnetic resonance imaging, also known as fMRI, to understand how music affects the brain. fMRI measures brain activity in different locations by the flow of blood to those areas. Scientists have conducted and found that listening to music not only activates the auditory areas of the brain, but also engages many other areas of the brain. Music also activates motor areas of the brain, revealing how closely connected music and movement are. Lastly, creativity can stem from music, allowing the brain to take on creative initiatives as it wanders freely in a healthy way. To narrow down potential genres to conduct my experiment on, I found studies that show music timed at 60 beats per minute relaxes people's minds and puts the brain into a more productive mode where thinking and creativity are easier. This led me to hypothesize that calmer genres such as lo-fi and classical might be beneficial for studying. This information was crucial in narrowing down potential genres to incorporate within my experiments. Here's my process. The experiment tested 5 girls and 5 boys. Each participant did 5 trials, 1 for each genre of music. The genres were lo-fi, rap, alternative rock, classical music, and house music. To help maintain accuracy in the study, an attempt was made to keep all variables constant. All the participants completed their trials in the same room, and this room is a small, square, minimal room located in the basement of the library with minimal traffic flow to minimize all distractions. All the participants also wore the same make and model headphones to ensure that there were no inequalities within audio quality. Each trial consisted of having participants read a short article about a specific topic and then answer 5 short reading comprehensive questions based on that article. Participants were allowed to read an article as many times as they wanted, but once they finished reading, they had to answer the questions without looking back at the text. They read the article and answered the questions while listening to the specific genre of music that was assigned to them. Once they finished the quiz, their answers were graded and scored out of 5 based off their correct responses. To give you all a better insight on the music that I played for the participants, I'd like to actually give you guys a sample of some of the music, and I'm going to start with lo-fi right here. Hopefully you can hear it a bit more so. Skip ahead a little bit before you guys do. As you can see, it's more softer tones, a little bit slower, similar to 60 beats per minute. The next one I'd like to play for you guys is rap music. It's a little bit different than lo-fi, more of a faster tempo, as you guys can see. And there's also lyrics as well, which is something to take into account. Next is alternative rock music. Give me 1 second. Similar to rap, more of a faster tempo, as well as has lyrics as well. Next is classical music. Similar to lo-fi, slower, softer tones, quieter as well, no lyrics. And next is, or last but not least, is house music. Jackson right there is moving his head. This is not the type of music you want to be studying to. I think you'd be in a house party if you're like a rave right now. Alright, so let's move on to the results. The graph indicates the average scores of the 5 genres with their standard deviations, which are these white tick marks that extend off the blue. As you can see, lo-fi has the highest score and rap has the lowest score, indicating that students did the best when listening to lo-fi and the worst when listening to rap. The genres that traditionally have slower elements and softer tones associated with them, like lo-fi and classical, produce better results. Here's a definition of lo-fi music. Lo-fi is short for low fidelity, which means it doesn't have the polished studio quality sound of high fidelity recordings, also known as hi-fi. Lo-fi is more raw and embraces imperfections such as ambient noise, static, or the hum of background conversations. The hallmark of lo-fi music is its ability to create ambiance, making it a worthy companion for those seeking a gentle acoustic backdrop for the daily routine. Lo-fi music is also often infused with jazz elements to portray its relaxed vibe. Lo-fi music is also often related to classical music and its ability to relax people, as well as help people focus on tasks. The last 3 genres, alternative rock, house music, and rap, are often not associated with relaxation, work, or studying. These genres are commonly categorized as genres that are simply listened to for pleasure. Alternative rock, house, and rap music often have more upbeat vibes that are commonly distracting when trying to study. Here's the next steps. Some of the potential next steps that I would love to take would be creating playlists designed for excellence within study. Based off the data I collected, I think I could confidently say I can create a perfect lo-fi playlist for people to use when studying. In the future, I would also love to test more genres to see if there are any other genres out there that can produce positive results. Aside from only creating playlists for lo-fi music, I would also love to create playlists for other genres that produce positive results, like classical music. If I were to complete this project again in the future, some of the things I would have done differently were having more participants to spread apart the data better. This would help in determining by how much is lo-fi significantly better than classical music or alternative rock. Another thing I would have implemented would have been a control group. Although my project was solely based on trying to figure out what genre of music is best for studying, I think it would be interesting to see how, when you listen to no music, how you would do in terms of your results, but as compared to when listening to music. That being said, I'd like to thank everybody. I'd like to thank everybody for coming out and listening to my project, and I hope that you learn more about music and its effects on the brain, as well as studying. And is there any questions?
I know at the end you touched on no music. How do you think no music would compare to the data you got?
I think that definitely when people listen to music, even if it's a music that's, often associated with like, calming and relaxing in order to produce productivity, some people still can get distracted with just like the beat of the music and like moving your head to it, and that can also often lead people away from, music. While if you had no music, there's nothing really to, there's no beat to listen to it also. It'd be interesting. Alyssa?
I was interested, you talk about like music's effect on the brain, and I was just interested because our brains change a lot from childhood to adulthood. So do you think the effect music has on study would change if we're in middle school compared to if we're studying for something in college or older? Would the music genre change that helps us best study?
Yeah, it could, because as you grow up, obviously you get exposed to more music, and your taste changes and whatnot. I think that would be something good to look at, and definitely good to study. And not too sure necessarily how it would, change the results, just because I didn't necessarily do my project off that, but it would be something good to incorporate in interested in study. So I don't really know the answer to that one. Gabby?
Was there anything that like surprised you like in doing this? Like anything that went against other studies that have been done or anything like that?
Yeah, I think something that was interesting is how alternative rock actually produced some slightly positive results, just because alternative rock is also listened to for pleasure and also contains lyrics, and lyrics have been proven to not be as beneficial when studying, so that's something that was interesting. Sasha?
Do you think like the volume of the music has an effect on the brain?
I think in some cases it can, but I feel like everybody's like listening, or their hearing is different, so some people can have better hearing, some people have worse hearing. So when I conducted this experiment, is I let people choose to put the volume at whatever volume they wanted that was easiest for them to hear, but it definitely could.
I just had a quick question about the rap. The particular song you played, to me it sounded like the music in the background was actually lo-fi. It was sort of like a pretty chill rap track. Rap obviously spans all sorts of different levels of sort of volume, what have you. How did you pick the particular songs within each genre?
I pretty much went off my own music knowledge. I'm a big fan of music, so I like to say I have a pretty diverse taste in music. So I tried to just incorporate some songs that I listen to, as well as just some other popular songs out there that people around campus listen to, because this experiment was tested on Williston students. So I tried to choose music that would have been what students would listen to give me more accurate results. Oops, sorry.
Do you think, because I've had students say that they have to have music to do any kind of studying because the quiet makes them more distracted and less focused. Did you get any feedback from your subjects that said that they always use music or that they need it quiet, especially students with attention issues that are easily distracted?
Yeah, since I didn't necessarily test a control group, I didn't get to compare those results. But from when I was testing the results, testing the people, I would have people tell me when they hear rap music playing, they'd be like, I'm not gonna lie, this is really difficult to focus to. So I think definitely, but also there's the factor of when you have no music, there's other sounds outside of the headphones with if you have music. So yeah.
Yeah. Do you have any sense of why, or any thoughts, just yourself, about why lo-fi beat out classical as the two instrumental genres that you did?
That was to me a little bit of a shock, because there's that stigma that classical music makes you work smarter. I think it's just how similar classical and lo-fi are in terms of the softer tones and then the beats per minute they're often created at. So I guess it was just just random that lo-fi happened to produce better results, but it's also not random because lo-fi doesn't necessarily have lyrics with it, and it's also has similar elements to classical music that differ from the other genres.
That's worked well. All right, thank you for your attention, everybody. We've got one presentation left.
So before we start, can you guys all do me a favor and tilt your heads to the left, please? No, tilt. Not turn, tilt. So bad news, you guys just showed me a symptom of meningoencephalitis in dogs. Hi, my name is Pearl Jet, and I'm here to present my scholars project, Is My Dog Swell? A Better Understanding of Canine Meningoencephalitis. Before we actually get into this, I'm going to talk about my process in this project. So first of all, the brainstorming. I knew I was going to take this class in the spring, and from spending my time here at Williston, I knew this class involves research, so I started brainstorming right away in the summer. I knew that I had to do a topic related to what I'm interested in, which is animal science, and if you see it over there at the bottom, that's me at the animal hospital where I interned. I was given many tasks, like taking care of infant puppies, preparing microscope slides, injecting medicine, and watching operations and all that. Another factor I considered when brainstorming was the level of difficulty of this research, and I just wanted to challenge myself. And finally, what really led me to look into neurological diseases in dogs is that my dog has a condition called hydrocephalus. He's over there with the bee costume. Commonly referred to as water on the brain, it's basically where there's too much fluid in his skull, then this causes weakness in his mobility, seizures, and even, difficulty in sight. So now the significance. Why is this important? Well, there's so many unknowns in canine meningoencephalitis, especially the non-infectious type. We'll get to that later. The treatments are also uncertain, and I'm doing this project out of curiosity. As mentioned before, it is similar to my dog's condition, and my goal here is to deepen my understanding of meningoencephalitis in dogs as much as possible. Finally, this is what the process in research is like. Originally, I was going to propose what I think would be a possible treatment or cause for this disease. The way I'd be doing that is by reading through pages and pages of research papers and lab reports, and crucially, I would email research institutions, animal hospitals, and veterinaries. From then, doing research, using the research I have and the people I spoke with, I would be able to, in a way, connect the dots and propose my thoughts on the cause and a possible treatment for this disease. However, as you can see, that did not happen. I did try to get into contact with all these people, but only a few got back to me. Therefore, my project had to take a shift, and instead of proposing ideas, I'm summarizing everything I found out and giving an insight on the next steps. So, what is meningoencephalitis? Meningoencephalitis is, of course, a type of neurological disease. You might have heard of encephalitis before, which is the inflammation of brain tissue, and you might have heard of meningitis, the inflammation of the layers of the membrane that cover and protects the brain and the spinal cord. And as you can guess, when I say meningoencephalitis, it's a mix of the two words. Meningoencephalitis is the inflammation of both the brain tissue and the layer that protects the brain, the meninges. This disease affects the central nervous system, and with that, it would affect both the spinal cord and the brain. Meningoencephalitis can affect dogs of any breed, age, and gender. However, studies have shown that some dog breeds like Chihuahuas, Yorkshire Terrier, Maltese Pug, and smaller breeds are prone to this disease. This could happen because these breeds may carry specific genes that are more susceptible to developing autoimmune diseases. Systemic clinical signs, or the physical indicators, are spinal pain, vomiting, dizziness, lethargy, lack of appetite, changes in heart rate, and fever. Neurological clinical signs, which are basically the signs that indicate a need for a neurological evaluation, include mood and behavioral changes, loss of balance, weakness in muscle and mobility, head tilts, seizures, and Cushing's reflex, which is basically where the heart rate is lower coupled with a widened pulse pressure. We can categorize meningoencephalitis into two: infectious and non-infectious, and I will be referring to the non-infectious as MUL, which is short for meningoencephalitis of unknown origin. These two types of meningoencephalitis is a collective term for a group of diseases, as there are subtypes. As in, what I'm trying to say is that there are subtypes to these types. So here's my essential question. How do we deepen our understanding of meningoencephalitis of the North region? The infectious type is caused by bacteria, virus, fungi, amoeba, and parasites that enter through the bite wounds, ears, and bloodstream. MUO, however, has no definite trigger. Many people believe that it may be immune-mediated, which means that it has something to do with the activity of the immune system. Some studies show that genetics may play a big role in this disease. As mentioned before, breeds like pugs appear to have more frequently affected than others. And other studies show that it may be caused by environmental factors or it may be related to tumors. Here are the subtypes of MUO. For context, the gray matter refers to the tissue that is primarily composed of neuron cell bodies. The white matter is made up of long nerve fibers covered in myelin. So the first is GME, which is short for, this is the only time I'm going to say this, granulomatous meningoencephalomyelitis. It's usually located in the white matter of the brain, and they're categorized by the formulation of granulomas, which are the clumps of immune cells. This can be affected, well, any breed can be affected by this, and there are 3 forms of GME, which is the focal, which affects only one specific area, the multifocal, which affects many locations in the central nervous system, and the ocular, which affects the optic nerve or the eye. There's NME, necrotizing meningoencephalomyelitis, is characterized by the inflammation of the white matter found in the deeper parts of the brain, and this can often affect small breed dogs. There's the NLE, necrotizing leukoencephalitis, which involves the destruction of the white matter in the brain, and this actually almost exclusively affects Yorkshire Terriers. So diagnosis is obtained from the observation and medical records. However, this still needs to be backed up by MRI and cerebrospinal fluid cytology, or CSF cytology. CSF cytology is a test that examines the cells in the cerebrospinal fluid to look for abnormal cells that may indicate a central nervous system disease. MRI can show regions of hyperintensity, which you see over there are the lights. On the right is a dog brain, on the left is a human brain, just to show what you can see. It's, again, a white bright spot in a region of the brain or the spinal cord that indicates an area of high signal intensity. This high signal intensity can indicate a number of things, including tumors, swelling, and inflammation. Treatment for MUO is usually given for months to years. There is no consensus regarding which drug and dosage to use, and different practices often use different protocols. Most commonly used treatments, however, are glucocorticoids, which have appeared as a good first-line treatment, later combined with immunosuppressant drugs, GCs for short, can lead to hunger, weight gain, extensive thirst, and urination. Therefore, the dose is usually tapered down with a range of 28 to 357 days of median survival time. Low-dose radiation has been used for anti-inflammatory effects, showing a mean survival time of 404 to 476 days. Mycophenolate inhibits the T and B cell proliferation. T and B cells are basically types of white blood cells that are a part of the immune system. It defends us against organisms that cause diseases. The median survival times range from 118 days to 731 days. So the follow-up. As you can see, median survival time ranges from months to years, but a significant proportion of dogs die within the first week of diagnosis. Relapse is extremely common, and that's because owners and doctors want the dogs to be on the lowest dose possible. This is because the dogs won't be affected by the toxic side effects of the drugs, and a lot of times, because of high costs of treatment and financial problems, dogs usually have to get put down. So what are the next steps? What I think, the first thing neurologists should do is compare a neurological disease in humans that is similar to MUO in dogs. Multiple sclerosis, MS, is a chronic disease that damages the central nervous system, specifically the brain and the spinal cord. Symptoms include vision problems, muscle weakness, fatigue, facial pain due to nerve swelling. In primary progressive MS, the medication GC may be used initially, But the mainstay of therapy has now been revolutionized by monoclonal antibodies that regulate immune cell function. Monoclonal antibodies are proteins created in the lab that bind to specific targets in the body. Dogs may take these antibodies, but there are limitations like time and cost. The next thing, I think, is to learn more about MUO in cats. While MUO is more prevalent in dogs, it is extremely rare in cats. In fact, I tried to get contact with one of the people I talked to, and he actually said that he doesn't know much about MUO in cats despite working in a clinic. Cats can be valuable for research, as this comparison between the two can help identify potential differences in mechanisms. Comparing findings like MRI imaging and CSF between the two species can help refine diagnostic criteria and identifying potential diagnostic markers. Thank you.
I have time for just a couple of questions right at the end here.
Why do you think cats still aren't having MUO as much? Do you think it's because of the conditions they live in, or genetics?
I feel like, well, from my heart, I feel like it's genetics. Dogs, from what I know, are always bred and always people always want kind of purebred, so that's why their genetics are always being passed on, and that's why they could have a lot of defects. In fact, my dog, which I didn't know, was bred a lot, and he actually has a smaller skull, which whenever his brain would inflame, it would be smaller skull plus inflamed brain. It's not really good. So that could be why, but I mean, it's not very researched, so I think people should start researching it.
Have you seen any connection between autoimmunity and MUO?
Yeah.
Dogs specifically?
Yeah, there's a lot of people, I think, believe that MUO is autoimmune, so it's because the immune system attacks something that's foreign in the brain.
Did you look deeper into the connection between MS and MUO? Is it more connected than or did you just see that they were vaguely similar?
I mean, my research kind of took a quick turn at into the 2 weeks before now, so I wasn't able to actually see and study through MS and kind of compare and contrast, but I think that would be a really good idea.
Excellent. Well, thank you all for coming. Excellent work for all presenters. Presenters, I'd love to get a quick picture of you together.